Good evening, everybody. I know it's a dream come true for every gynecologist to hear or to have an interview with Dr. C N Purandare. I need to say the Dr. C N Purandare. Can I have? I know it's very difficult to know about or to read about Dr. C N Purandare in one slide. If I talk about his CVs, his achievements, his position, it itself will take hours. These are in brief his various achievements. I was always tell in jokingly about his degrees. Many of these degrees and the countries we are probably unaware of. And that's what Dr. C N Purandare, what he achieved in one lifetime may be difficult to achieve in 10 lifetimes. So it is a proud moment for Pune OBGY Society. When we release every month news bulletin, we take one of the legend and we have his interview, his or her. And this month, we wanted Dr. C N Purandare, the legend, and his interview runs with the president of Pune OBGY Society, that is me, Dr. Sunita. I need to thank COVID pandemic for this, because without COVID pandemic, I don't think we would have got such a novel idea. Friends, for you to know, sir is not in India. As always, he will be in some other part of the country. Now he is in Birmingham, and he is kind enough to come to have 1 hour discussion with us. We all know that he has made entire Foxy proud by becoming a president of FIGO in year 2015. He was a president of course, Federation of our OBGY, Foxy, in 2009. He was Emeritus Dean of ICOG. He is Editor Emeritus of Jogi, which we all are so proud of, and the way it has reached, it's a hard work, guidance, which Dr. Purandare has kept on giving to the entire generations, years after years. He has confirmed various fellowships. We are going to go with those fellowships. I know this slide is going for a long, so you all will read yourself. But he has from every corner of the world, from the most prestigious institutions from the world, may it be UK or may it be US or may it be South Asia, he has fellowship or honorary fellowships, I should say, including from Taiwan and Emerald Association of OBGYN. He got many Lifetime Achievement Award. Few to mention is from IFS in 2015 and from Foxy in 2017. He has been awarded many awards. Few to mention, which are very important, is Dr. B.N. Purandare Award in 2016, Dr. B.C. Roy National Award for, we all know how prestigious it is to get Dr. B.C. Roy National Award, and he has received it in 2016. He has been given Rashtriya Gaurav Award for the contribution and excellence in the field of OBGYN. He has Srimati Lakshmi Bai, I think it should be Holkar Award, Lakshmi Bai Holkar Award for contribution in medicine, Dr. Ganatra Award, Dr. Saroj Desai Award. He has been awarded Foxy Best Book of the Year Award for 3 consecutive years, or maybe random, but 3 years. He has received Best Book Award. That shows his academic and public interest in his publications. He is consultant for Mumbai Police. He is also honorary consultant I think yesterday only I read about his Saifi Hospital and Elizabeth Hospital. But most important thing is he's also ex-honorary professor from Grand Medical College, and he is emeritus professor to JJ Medical College. That is very prestigious post he is holding. We all know Purandare's modified radical hysterectomy operation for CS cervix. We all learn it, we all adopted this, and he has extensive experience. He's known as a vaginal surgeon. I think Purandare's and vaginal come from generations to generations. So today we have Dr. Purandare here with us. Many may not know, including me, about his young age, his college age, his education, or his work in a Foxy, in FIGO, and various organizations, his leadership quality. I think these coming generations should know more about Dr. C N Purandare. And what is in this digital world you can do is, one, you do the Facebook live, you can make a YouTube videos, and even this is what one of the painting his friend, I think, sir, we as a surgeon are skilled, and this is your student who has given you this beautiful your painting. I think you should make a 10 copies, and all the your houses everywhere in the world should have it, because it's really looks like a real Dr. C N Purandare. I'm sure, sir, you must be feeling proud of yourself. Looking back to 50 years of your journey, you must be feeling very satisfied. But what everyone notices is you are very much down to earth. You are grounded. You are flying high, but you always walk on the floor. And that's your quality. I think young generations and everyone of us from even my generation should know and should follow that. We all know that it's very difficult to follow your footsteps, but even if we can walk 10 steps of yours, we will say we have achieved something in life. So, sir, can I start you? I know in Dr. Shanta Kumari's book, you have written about your childhood and everything about the Purandare's family. I would like to take you little more about your formative years in medical school. Whether you were determined so much being a Purandare. I know that Foxy office was in your hospital building. So Foxy entered into the gene with genomic modification, or it just automatically you kept on developing the interest into the organization. How was your medical school first?
Well, I joined medical college on a different note itself. My father wanted me to become an engineer, and I was in an engineering school. And somewhere around when I was 14 years old, my grandfather was very seriously ill, and we were very closely attached to him. And all the top bigwig physicians and people around in Mumbai were visiting him to check him out and so on. But I always felt that as a child, a small child, that why can't they save him? I mean, it was at the age of 87. Now, when you look at it, it was a age which was very well enjoyed through the family and everything. But I made up my mind to change over to medicine at that point of time. And when I finished my SSC those days, 11th standard, it was uh, with technical subjects. I never learned history, geography, and it was electrical engineering, mechanical engineering, machine drawing that I. And when I finished my first year, those days there was first year and inter science, and if it first year you had to decide which branch do you want to take, engineering or medicine. And I finished my first year, and I was going in to put in my papers for the inter science, filled up all the form at home, and on my way to the St. Xavier's College, I changed that A to B group, and I came back to tell my father that, well, I've changed my line, I want to take up medicine. And he said, well, if that's what you want, just go ahead and do it. And I landed up doing medicine subsequently, and joined Tupiwala National Medical College, which was nearest to our house that time. It was at Bombay Central. And if you ask me about the formative years, medical school is all fun, really. When you look at it for the first 4.5 years, you are not determined to do anything in particular, and it's the group of students you are working with, and the anatomy and the physiology and the clinical ward work, that it's great fun in the end. And it's only when you finish your MBBS and you start your internship and the residency, you realize how hard work it is, and
Mm.
it's no longer as fun as the medical school is. And uh, when I finished my internship and I was doing my interviewing for the OBGY, and managed to get the OBGY that time and I worked under Professor S.S. Thakur. And I still have a picture of him, which I have sent to Sunita, which uh, when you look back, um, after so many years in 2016, when I was FIGO president, I gave the MOGS SS Thakur oration, and he was sitting across on the first row. So it is a great sense and a feeling that you get when your own teacher is sitting in front of you. And I finished my MBBS and the MD from Nair. But during my MD's, my registrar's posting was 1 year at Bhagwati Hospital, and which was at Borivali. And I was a registrar there, and my boss was Dr. G.B. Belvi that time. And in the first month itself, he said, um, you can go ahead and do your surgeries. You're fully capable of handling it, and just go ahead. You don't have to wait for me to start the list. And at the end of 1 year, a registrar's post, I had done 150 major surgeries, and that's something which is unheard of for any resident doctor. And the amount of confidence that he gave me, and I did 4 radical Vadams during that period. The first one he assisted, and then he said, well, you know how to do it, just go ahead, I'm standing out, and if you need me, I will come in. So it gave such tremendous confidence in the surgical techniques that. And we had so many house officers who were working with me, and all of them did equally the surgical work, because there was so much work. And when you look at it from the point of view of the work to the end result that you see in life, it's the volume which makes you really perfect. And
Think so, sir. Doing a post graduation in India from the government college, there what happens is you get clicked, because the volume, the number of cases, the pathologies, and the same pathologies again and again, so many cases we see. That makes you master. And it was in your you know what, sir, just now, I last year I was a president of Indian Association of Gynae Endoscopy. Dr. S.S. Thakur probably is the same who was also the president of IAG.
that's right, yes.
And we were searching for his photo everywhere. Can anyone give us a photo of Dr. Thakur? And we just could not have his photograph. And look at this today. Now I will take from you and go back and put in our YouTube that Dr. S.S. Thakur. We were not knowing from where to get his photograph, and you are just talking to me. So definitely, sir, I think it was in your gene, and then in your residency, it is your teacher who makes your life. Same is my story, sir. Of course, today is not about my story, but today what I am is because of my residency. The amount of work which was given to us, automatically you want to excel. What next? After that, how was you finished your MD, then you went to Ireland to do your OBGYN, further your FRCOG, MRCOG. What is that program, sir? How did you decide to go? Because you had established everything here, ready to start. You had all surgical skills. So how the thought came to go, and do you feel it was worth going in, learning their etiquettes, the manners, the way they speak, the way they handle the patients?
Well, I went to Ireland purely by accident, I would say, because
You
while I was,
entered in a medicine by accident. Then you
yes,
went also in Ireland by accident.
absolutely. I mean, in the sense, I was at my in-laws' place just when I finished my MD, and one of the greatest obstetricians India has produced was Dr. Aru Mulgaonkar, the Mulgaonkar forceps that you have all heard of.
Yeah.
And he was there, and he said, "Young man, you should come to UK and do your remaining part of education." And he was that time consultant in Basingstoke Hospital, close to London. And he said, as soon as you finish your term as a registrar, please come to UK, and I will see that you get the job immediately and you start working there. So I went to see him, and I started work there with him in Basingstoke, firstly as an observer. And he asked me, is there anything specific that you want to learn in OBGY? And that time, epidural anesthesia was the in thing. And I said that I would like to work in a place where there is regional anesthesia and delivery is happening in regional anesthesia. And he said that if you want to learn that, you have to go to only one person in the world who will teach you how to do the anesthesia in labor, and that is Fergus Meehan in Galway in Ireland. So he wrote a letter to him, but there was no reply. Unfortunately, there was a postal strike there in Ireland that time, and he couldn't get the reply. So he gave me a copy of that, Aru Mulgaonkar, and said, "You go there and meet him and just show him this letter and see what if he can offer you something. Otherwise, you come back." So I went there and I met him on a Sunday morning, which I read him, and he came to the hospital, and very dashing individual who used to drive a sports car, and he just walked in, and I introduced, and I was telling him what I have done. I've done my MD, I've done this, that, and the other, and I gave him the letter, and he was reading the letter. He was sitting there in an armchair, and I was standing there, and he read the letter, and he said, "If Aru Mulgaonkar says that you are good enough to work with me, you start work tomorrow." So that's how I landed up working in the university hospital in Galway, and worked there for 5 years. And I didn't move out of that place at all before returning back to India.
So, how come you decided? So, you had a quite glorious opening there. You would have settled there very easily. How come you decided to come back to your own country?
Uh,
That was
well,
always
the
in your mind.
situation was different those days compared to what it is now.
Mm.
Means for a non-national to establish there, become a consultant, even though they were at the end of 5 years, they were willing to give me a consultant job. Um, eh, you could probably remain as a second great citizen in any country which is not your own country. And I thought that and in 1982 December, V N Purandare, on his way to FIGO conference in San Francisco, stopped over at in Dublin, in Galway, and he said, "Why don't you come back? Why do you want to continue here?" And that's how I returned back to India. And I think it was one of the, looking back, one of the most
Important.
important decisions in my life. I would not have been a FIGO president if I had remained there in Ireland, And just because I was in India, I could reach that level to become the International Federation's president.
I totally endorse you, sir. Wherever you walk in, you may be staying there, but you always have that feeling of second citizenhood. And when you walk on an Indian road, we feel, oh, ye to mere baap ka road hai.
No, but let me tell you something. Situation is different now here, even in Ireland. The Irish, more or less, are very close to Indian in thinking because they were also oppressed by the British,
Hmm.
and they got their independence and so on. So they are not really for the British. And today, if you go to see, there are so many consultants. My son is a consultant here in, as luck would have it, he after traveling back to India, doing medicine in India, coming back for post graduation in Ireland, and he has become a consultant in the same hospital where I was there, and same hospital where he was born. He is now a consultant delivering in the same labor ward. So it's destiny that sometimes.
Play a very important role, and it amazes you from the time to time. You never would have dreamt 40 years ago that my son will be here, who has just born, he will be rocking here. So that's a beautiful thing. But you came back to India was a luck to Foxy as well. You have taken Foxy with your consistent efforts for 2 decades nearly, and even now you take equal interest in an organization to keep it growing ahead and ahead with your vision of internationally. You are taking many Foxy team leaders to the international platform. We all know that. Uh, can you highlight how you did a transformation into Foxy? Your vision helped Foxy to grow.
Uh, well, I must give that credit to MOGS first, because if I was not in the MOGS, I would not have gone to Foxy the way I went ahead. And of course, to Dr. V.B. Patwardhan, who was a consultant in JJ Hospital that time. I joined JJ 2 years, a year and a half after coming back to India, and he was a consultant there, and he was a man of vision as well. He promoted everybody, and I think if he had not promoted me, I would not have been in MOJS or in Foxy the way he promoted me. And those days were, of course, again different because, as you know, institutional rivalries were there, and you had KEM and Wadia on one side and JJ on the other side, and all the organizations were literally dominated and run by KM and Wadia, and others had no chance at all. So it started off with MOGS, where you have all fought elections at various levels to go into even Pune OBGY Society at various levels. And we started off with getting the resident doctors and the team together, and I managed to get in onto the executive board of managing committee of MOGS. And then it was PK Shah who came to me and he said, CN, we are on the periphery, nobody even looks at us. So I said, okay, fine, you join hands with me and I will see that you are in as well. So the Sion Hospital people got in, and now, of course, the institutions, organizations everywhere, there is no such thing as lobbying that happens. It's a individual performance and good capability that have really made. And then I moved into Foxy because of Patwardhan, who made me the joint secretary where during his presidency. And then eventually, one of the elections, I got elected as a treasurer, and I knew a lot about accounts, and I managed my own accounts as well with my CA when I was practicing. And I found that most of the treasurers of Foxy were just what we call in Marathi as Sayaji Rao. You just sign the document which is brought by CA, you sign at the bottom, not knowing what is there inside and etc. And I went into the detail and found out that at that point of time when I became a treasurer, the Foxy was minus 20,000 rupees. 2 lakh rupees, sorry. Was it 2 lakh rupees? Yes, 20 lakh rupees. Sorry, it was minus 20 lakh rupees. And we had to pay the income tax, which would have accumulated and which would have really wiped us out completely. So I went into the depth and then told them that if we have a charitable organization, we don't have to pay income tax. Why are we paying income tax all these years? So I went to the income tax office, recovered the money which was even paid before, and canceled the money that we were supposed to do. And then the whole system of working was modified. From treasurer to deputy secretary general to secretary general, I completely transformed the system to organization which was people were using it just to sit in the chair and go away, into organization which was nurtured further to become a financially extremely viable and a strong organization. And look where it has gone today. It is worth crores of rupees at this point of time, with all the we moved from Purandare Griha to Kama Hospital because the area was short, and then from Kama Hospital to Parel, when we bought the premises, there was so much opposition for buying that premises. And some of our colleagues, and I mean, the way they commented was, um, I can't use the word, but I would say nauseating, that anybody could make comments about these things. And it was PK Shah and myself, we insisted that we will go ahead and buy that premises. And from that premises, then to Kamala Mill, and it just going up and up and up. And I think today we are worth a fortune, really. One of the best managed, best organized, and financially the best organization in any organization that you can
in the
talk
world.
of in country.
So, see, this is also very important that those who are maybe chairpersons of the committees, they should know what the previous presidents or previous generations have done to get this Foxy to the height, and they ensure that they take this Foxy further height. So this was immense. So from Dr. Thakur meeting you at the right time, then Dr. Mulgaonkar, and then Dr. Patwardhan. So you need to be fortunate, not just because you are Purandaris. You were having a right people in the right time in your life who made the turning point. And I think, sir, probably that has come into your nature. Inclusiveness, taking people with you. I just want to say one thing. Once me and Dr. Hema Divakar, we were chatting, just non-specific on a phone. Probably she also had a time. I also had a time in the evening just 6 months ago. And we were talking. I don't know how come subject landed about you. And she said, you know what, Sunita? Once I went to Figo, Dr. Purandare called me. She was in some of the meeting involved, and she was the only one from India. And she said, in the morning when I got ready, I saw Dr. CN waiting for me in the lobby. Come, Hema, I will take you. She said, this was my first meeting, totally in a different land altogether. I was not aware Dr. Purandare will be waiting for me. And he makes you feel, yes, he was at that stage, and that was my first meeting. And this is a gentleman who waits, thinking that हमारे ये इंडिया से मैं छोटे लड़की को लेके आया हूँ, it is my responsibility to take care of her. You had already so many feathers in your cap. She said, these are the small gestures of Dr. C N Purandare which touches to your heart. Probably this is from the beginning you have seen. Of course, I'm seeing your students, your colleagues, how you pulled them into the organization to get the organization going, whether at national level or an international level. Today, we are seeing Dr. Shanta Kumari becoming a treasurer of FIGO. She gives 100% credit only to user. Dr. Hema, whatever her contribution, or Jaideep, their contribution or their entry into FIGO is your role. But who took you to the FIGO? From a Foxy, your journey to FIGO, how did that happen?
Well, I'll tell you, I was president of Foxy that time, and just before I became the president of Foxy, when I was Secretary General, Bera Manklesaria was the FIGO representative, and he was on the board there representing India. And he said to me one day, he came to me and he said, he used to call my close associates and my family call me Ranjan. The Chitta Ranjan, short form of that is Ranjan, and they all call me Ranjan and not CN, as the medical fraternity knows me as my initials as CN. So he said, Ranjan, I am not interested in pursuing further in FIGO. If you are interested, you go in my place, because your exposure there as a committee chair, the council member, would help you to go ahead. And that's how I attended many of the meetings in in place of Bera Manklesari. I mean, today, if you ask anybody that you are on the FIGO Council or somewhere else, or even for MOGS Council or Foxy Council or whatever it is, nobody vacates their chair to give anybody else a chance to go there. That's competition that is happening. But
Yes.
he was a great man, and he said that you go and you attend those meetings because you have a much more chance of going ahead than me at my age. So that's how I landed attending the FIGO meetings, and then the treasurer job came up. And at South Africa, India's nominee as me as a treasurer, we went in there. And knowing very little about the international politics. I mean, I knew that there was a job coming up, and the elections will be held. And you know who was my lieutenant there, with 40 people there, with a brochure, giving out brochure to everybody, telling them vote for our India candidate, and that was Shanta Kumar.
Oh.
That was way back in 2009. And unfortunately, I lost that election by exactly 3 votes, and that is because of poor political maneuvering, because we were unaware of what the international politics was. And unfortunately, when I filed in my papers, somebody else from India filed in papers some other position. And
I was
people
telling
said,
that Foxy meeting about that lady.
and people said, how can two people stand for the trustee's position? And both lost. I mean, this was, we realized that this was one of the major blunders that one could have. But sometimes you can't tell people that what you're doing is not correct, because they feel that they know everything, that kind of thing. But anyway, all the same, I lost that election. And when the president's position came up, India's, I applied for that position. And that also was a big issue, why my name was being proposed, why not somebody else, and so on. But anyway, you have to go through a lot of hurdles when you have to have
I
success.
was there.
The
During
hurdles are
that time,
always there.
I entered in a Foxy and we had a minutes of the meeting reheard and we all voted. I do remember everything, sir, that
So
uh,
anyway, so when I stood for election at the president,
Figo.
the Asia Oceania Secretary General called me up and said, withdraw your nomination. I said, why? So he said, no, India already has had two presidents in the past, so you have no business to stand for election. I said, at the most, what I will lose.
I'm
Why should I withdraw? Why should I withdraw? And they were supporting China that time, and Chinese was very moneyed. Each and every president of the country, 130 country presidents, were sent bone china set as a gift so that they would vote. And people said, what are you going to send now? I said, I'm not going to send anything because we can't afford also to
I,
send this kind of thing. If I get elected, fine. If I don't, that's also fine. And then, believe me, as much as elections are fought here, and there is so much. There is religion involved. There is a color involved, everything involved at the international level. I mean, don't think that it's these things don't matter. And finally, the elections were so close, and I did manage to. The last bit was between China and me, and we won by 60-40, and that was something which is phenomenal. And people still remember as the screen showed 60-40, there was PK Shah who was sitting in the audience voting for it, stood up and said, hooray! And everybody was started looking at the Indian contingent as to who is this gentleman who is screaming aloud that we have won? And so that's how it all happened. But um, the important thing, as Hema said something to you 6 months back, is that when I went to Figo, I said that uh, previous presidents have been there from India, illustrious people, but I don't think any of the other Indians got a chance ever to be further on in the organization. And I got 10 people, three, four committee chairs, the remaining five, six on various committees,
and
and make sure that all the Indians were there and the presence was felt. And I mean, the Indians' hard work was shown to everybody. That I just didn't pick anybody for the sake of picking. We had the scientific committee chair who knows the Sharia, who did a phenomenal job at the Rio Congress. We had various committee chairs which are there, the committee members which are there, Sanjay Gupte, Jaideep Malhotra, Hema Diwakar, and so many of them. And pardon me if I don't mention everybody's names, but Shanta Kumari was there as well. So everybody whom I thought was good enough to portray India's
future.
capability in there, I got them there to be present there, and they did fantastic job. And I'm proud of them that they not only made me proud, but they made India proud by being there.
I agree. I agree. I just, at the time of my installation with Hema Divakar, we did a FIGO workshop. And that time, for 2 months, we were talking to each other. And that is the time when she shared your things. And that FIGO workshop was fantabulous. She got best of the people to speak of diabetes in pregnancy and blood pressure, hypertension in pregnancy. It was fantabulous. And I could feel that the Hema's contact with these, where of course it is her inbuilt talent comes, but then she needed someone to pull into that boat of a Figo, and you played a very, very important role of getting these people. But apart from these, as a Figo president, what do you think, like how in a Foxy you changed the finances of a Foxy altogether? You got a Foxy into the profit. You made everyone understand what is the Foxy and accounts and all. Naturally, money plays a very important role apart from the strength of the membership. That is why the Foxy becomes stronger, because of both the things so much. So as a FIGO president, how you felt with your knowledge, with your experience, you change FIGO, or you took that FIGO to the higher level?
Well, I went before being the president. I was the president-elect for 3 years, and I realized one thing, that the organization was completely dominated by non-Asians and Africans. And it means the organization is supposed to do something good for the underdeveloped, but none of the underdeveloped countries had any representation there, and nobody was in the chair. And you found that after after 10 or 15 committees that were there, they were distributed between America, maybe few in Europe and UK, and that's it. And nobody else was anywhere visible anywhere. So when I went there and I said that the first rule that I'm going to follow is that if there are 10 countries, 10 positions which are there, then they will be equally distributed between all the 5 zones. So all 5 zone chairpersons will be distributed. And not only that, if there are 6 people in each committee, so that would be about 60, 70 people, they will be equally distributed between all the regions of FIGO, which are 5 regions. You have Europe, America, Latin America, Europe, Asia, Oceania, and Africa. So distributed and got the best of talent from everywhere else to become the chairpersons and committee members and so on. And they did a phenomenal work. And I believe me, in those 3 years, what has happened, never in the history of FIGO it has happened, and neither in the last 3 years which I have attended as immediate past president, anything like that has happened. Of course, when this kind of turmoil takes place, there are, you develop enemies as well. And I mean, you can't expect everything to be hunky dory, because you have dislodged the system which was only a system which belonged to them. And I got that passed as a constitutional requirement, that the committee chairs should be equally distributed between the regions, and with including the gender as well, so that equally women should be there on various positions as chairs, as committee members, and so on. And that opened up a huge opportunity for everybody in the world. And today, when you see so many people from Asia, Africa, making their way in and wanting their way into FIGO, because they feel now they have a chance which was never ever there.
So, in spite of Asia Oceano telling you not to contest, still you took everyone with them, you. And probably because of emojis and a Foxy, you knew that if you make a constitutional changes, then only this will be a long lasting. Otherwise, it will be only of your 3 years presidency. That's a
Absolutely.
wonderful thing.
Absolutely. Means unless it is enshrined in the rules,
No,
nobody follows them. When you're gone, people will take over and again go back to whatever way they want it, and do whatever they want. And it's once it gets enshrined in the constitution, in the rules, bylaws, it is very difficult to remove those bylaws, because if you try to do that, there will be people who will question you, that why are you removing this? Is there any reason for removing that women should not be there, or Asia, Oceania, and Africa should not be represented? It becomes difficult. And I managed to do that, and not without having enemies. And well, but as Winston Churchill has said, if you have enemies, it's good. It means that you have done something good, and people are appreciating it. So
absolutely.
that's the way it is.
So again, you had a right person, Dr. Anklesh Ria, coming in your life, and probably he has seen a goodwill in you, that if I give opportunity to this Dr. Ranjan, probably he will do the job. And I think you took everyone. Now, apart from these organizations and all, being in so many organizations, you must have played a very important key role in a woman health. So, whether you think because of the Foxy presidency or because of the FICO presidency, you made any impact on the health of a woman?
Well, if you look at over the years in Foxy as well, the last 20 years, the number of women who have been at the helm, or for that matter, as vice presidents, there has been a sea of change. It was only dominated of by men, and very few women were there at that point of time. And I remember from my treasurer's days till today now, maybe more than half are women who have taken over in Foxy, and various committees and everywhere. After all, it's not that men don't do a good job. It's the opportunity has to be given to everybody. It's not only one gender's responsibility, or they are the ones only who can manage. And I go back to when you treat your juniors as colleagues, it makes the major difference. As when Hema said that you, because the junior person may be maybe 20 years younger, but they are looking at you as if scared that who are you going to talk? How am I going to talk to this individual? But if you behave with that person as a friend, as a colleague, that makes a difference, and that person performs better. And I mean, I remember when my first day in surgery in Ireland, I finished a major was given to me because of my work which was done, and I came out and my boss was having his tea, and he asked me, "Would you like to have a cup of tea?" So I said, "Sir, I'll make my tea." So he said, "No, you were doing surgery. You did work. I'm just sitting here. I will make a cup of tea for you, and don't call me sir," he said. The usual Indian thing is to call your boss sir and carry their bags and whatever it is. He said, "Don't call me sir. My name is Fergus. You call me Fergus from tomorrow. And remember one thing, I am Irish and I have no intention of getting knighted and being called sir." So that nationalism and thing was also seen there as and I when I returned back to India and I became a consultant, honorary consultant in JJ Hospital. All my residents are my friends, and I mean, whether it is Nandita or the junior most people who work with me, and we have a big WhatsApp group which is called the A Team of GMC, and we constantly are in touch with each other. And during my tenure, every indoor day, it was a common practice that I would take all my residents to the canteen. We sit down, have a drink, chatted, and then I left. So that made a difference, that people even today are able to come to me for opinion, whatever, because of the freedom that they got talking to their boss.
Yeah. Now, sir, you are also coming from the organization, leadership, education. You are editor emeritus of our journal. What do you think, evidence versus experience versus expertise? Many a time, see, Dr. P.C. Mahapatra always says, those who work don't publish, and those who publish don't work. But that's not true to many extent. I do understand experience makes you expert, but it's a evidence, and that's how you can make your name internationally by your publication. What is your opinion on this?
Well, I want to tell, since PC Mahapatra's comment, in 1982, I was at an oncology conference, and Sir John Stallworthy, who was head of the department as a Nuffield professor in Oxford, was there, and he was my boss's boss while he worked in Oxford, and he introduced me to him. And he interesting story, really. If you have the time, I will just make 1 minute of.
Mm.
He looked at me and he said, "Hold on." I said, um, "Are you?" He asked me, "Are you from India?" I said, "Yes." "You are from Bombay?" I said, "Yes." I was completely flabbergasted. Never seen this man. He had never seen me. And he said, "You are a Purandare." So my God, this is something which is even my boss was shocked. He said, "Young man, you have a stamp on your face." And I asked him at that time that whether why has he not written a monogram? Sir John Stalworthy was the name. He said, "I want to ask you one thing. Has B.N. Purandare written any monogram?" I said, "No." So he said, "Those who work have no time to write, and those who write have no time to work. They don't work." But that is the same thing what uh, PC said, but situations are different. Today, evidence based medicine is the base, and the recommendations that come in from the evidence that is available. Unfortunately, there are bad sides of that as well. Means I have seen at WHO level meetings where the recommendations are coming. I have been a part of those meetings, and a lot of the times people generate evidence. It is not evidence which is really evidence, but it is falsely generated by help of pharmaceutical companies, with the instrument companies, or whatever it is. And that generated evidence, they write in 10 different journals to make sure that those articles are written, and they are combined together, say, to show that it's evidence. Look at what happened to the mesh. Same thing.
Mm.
Look at the hysterectomies and Marina, how change has happened with the evidence which is seen. So all these things, and that you have to have a look at it with a pinch of salt. Evidence, yes, but in India, a place like India, the experience is so vast that I did this and therefore this is the way to do it is not the answer to the publish what you have done. If you have done maybe 10,000 hysterectomies, produce the evidence that what is in those 10,000 hysterectomies that you have really achieved, and let that be evidence which can be picked up by juniors to form the
I agree
recommendation.
with you, sir. Especially we have entered in ART field. Sometimes you feel so pity. What you rightly said, the pharma company, they change. They take the statistics which they feel is a right to show the p-value and the end result. Then taking all. Now those who are a contributor for that maybe. I can't say the name, but for that particular study, they involve the group, and from that group, few of those tables have been taken out nicely. The data comes what pharmacy wants, and it gets publicized. And the young generation, probably who don't have much knowledge about it, just say, "Oh, this study has shown this drug better, and that's why we should be using it." It may not be giving better results to you. It takes a lot of time. Only when we attend these small group international conferences, we come to know that certain people, even if they publish on letrozole, it gets published. If I send a publication on letrozole today, the result will come in 2 days. There are 15,000 publications, and there is nothing you are doing new.
You're absolutely right, but that's the way it happens. And for example, now allolestranol, the gestanin tablet which was available,
Mm.
people poured in that gestanin tablet to women during pregnancies because it was a couple of papers came in that this is the drug which should be helpful in continuation of pregnancy, in threatened abortion, and so on. And 20 years down the line, it has been proved that it is waste of time. It is worse than a glass of water. Means if that is the situation, the pharma company in those 20 years made millions out of patients and doctors prescribing it, which was absolutely rubbish. You have heard now recently about statins being prescribed $3 trillion business in America in statins which have been given. So there are situations which you have to look at it from the pinch of salt. And the New England Journal of Medicine, one of the top editors, has said that the evidence which is generated like this is destroying the fabric of medical knowledge.
Do you think, sir, at our yogi level, you made some difference? You did not allow all these things to come into the picture?
Well, I think I must give this credit of training me to really look at the articles, value them, evaluation from to Dr. V. N. Purandare and R.D. Pandit, who both of them were so meticulous in doing things, and they really trained me right from the junior most position to evaluate the papers and really understand what is the truth behind the publication that has come for publication. And that is where the selection, the editors make a lot of difference. If somebody who's just being there for the sake of being an editor and certifying anything and everything that is happening around, it doing injustice to medicine by doing that. And I think subsequent to my being there, there are a lot of editors. Suvarna has been there. She has done a commendable job as an editor. So I think Jogi is on the right path, and we are producing very good quality journals.
Evidence-based journals without pampering this. I'll tell you, sir, I can't tell you the name of the journals, but recently we had a bilateral fimbrial agenesis. When we digged out, there are only 29 cases of fimbrial agenesis, and 80 to 90% of them were unilateral fimbrial agenesis. Our was bilateral fimbrial agenesis with intrauterine complete septum. I sent it to international journal. In less than 24 hours, I got the result. We are sorry, there is nothing great in publication. Now, I just happened to see yesterday their journal, which is on a uterine septum. What is there great to type into the uterine septum, but a case report of a broad septum and septoplasty has come into this journal. So sometimes we have to value our own Indian journals, because our Indians, they really work very hard. As you said with the yogi, same way in our infertility, human reproductive sciences is making huge thing. So again, those who are listening, they should understand that. Make your own journals more proud. Also,
But
sir,
Sunita, I'm not surprised when articles are sent by developing countries consultants. They think that these are non-entities somewhere uh, sitting on elephants and going from one
I
place to another. And it's sad, really, that
sir,
undervaluing the, and that is why I said that it's time that India consultants also went abroad, stood tall, and proved to everybody that. And as I said in my yesterday's talk with you, that Indian surgeons are the best. I mean,
yes,
I've traveled all over the world. I've seen surgeries all over the world. You cannot compete with the Indian surgeons. So it's something which is we should be proud of, and we should make sure that the other people abroad know that we are capable of what we are capable of, and much more than what they are capable of. I mean, it's time that we did that.
very true, sir. Also, now coming to your hobbies, sir, this study, OBGYN, organization, leadership, women health, All this is one part. Apart from that, did you perceive or do you have any hobby? Naturally, traveling came as a part of your profession and everything. Anything else in a childhood you used to love doing?
I'll tell you, as far as sports is concerned, cricket is something which is imbibed. And whether it is 2 o'clock in the morning that there is a match on TV to
Till
sit
you get
there and watch, it has always been something which we have done. And my wife used to grumble that if the wicket fell at 2 o'clock in the morning, I would shout out and call my son to say that, come and have a look at this wicket. And she said, what is going on? It's 2 o'clock in the morning. But that's the way it is. But I think a lot of sport came to our family because of Geeta. I mean, Geeta has been a great sportsman herself. She has played for the universities and so on, a great badminton player. And the children also, and they still do gym and um, whatever that needs to exercises with. I am yoga, and I'm not a person who would spend time over. And I must agree that besides medicine, I did very little other than OBGY 24-hour job that we did. As you know, delivering at odd hours and being there for each and every patient. But it gave its own satisfaction as well.
I agree, sir. It will take lifetime for a people to travel what you have traveled in your 30 years. One last question. I know there is one phone call which is ringing you all the time because it's afternoon there. How would you describe Dr. C N Purandare, Dr. Chittaranjan Purandare, Dr. Ranjan? How will
How
you
do I
describe
describe
it?
it? You are asking me a very difficult question. This is something which somebody else has to describe me. I cannot describe myself as, uh, but I believe in one thing, which that success doesn't come just
Easily.
like that. It's hard work, and your dedication to the profession, to your work, everything that makes you succeed. And that's the basis of everything. Unless you work hard work and hard work is what is needed. And if you think that because you are so and so's relative, your life is made, it's not like that.
Yes.
We have seen people who are sons and daughters of great surgeons and obstetricians, and wither away in as non-entities. And you see people who are nobody, who coming up in life and um, being what they are. And it means, personally, I feel in my OBGY growth, um, I would give my full credit to the three teachers that, and they were all from GMC, mind you. Dr. Thakur was originally from GMC, Dr. Belvi also, and Dr. Patwardhan. They all three of them were from JJ Group of Hospitals, and JJ is the one which nurtured me further to for 20 years to become what I am today. And I would say that. My students have been my greatest teachers, because what I learned from them, what I gathered information from them to go ahead in life, is something which has helped me tremendously in going ahead. And I appreciate. Somebody said when I became the president of Foxy, one of the slides showed the names of all my residents who were there and who were my students. So people said that for the first time ever, a Foxy president in their inaugural lecture has given names to the students, but I think they are the ones who have really made me what I am today.
So, sir, hard work, passion, perseverance, even if you lost treasurer, you went for a presidency, your leadership quality, belief on yourself, all help. Meeting right people at right time, turning points, taking B group from A group and entering, meeting people at a right time, all that is one part. Your hard work, passion, success is one part. Do you think your spirituality, are you a spiritual person? And do you think the blessings of God all the time helping you, taking you ahead, or you feel it is just the success came because of the hard work and the passion and the goodwill?
Well, I believe that everything is destiny. I mean, if it is written up there on your forehead, it will come to you. Whatever.
Believe God? Do you believe God?
No, I do believe in God. It's not that I don't believe in God, but I believe that there is some. I have said so many times that there are patients who are you're working very hard to and they survive, and you equally work hard for somebody who don't survive. So we don't know which one is going to survive, which one is not going to survive, and it's only we are only a tool in the hands of the Almighty. The doctors are not God themselves. If people say, "Tell me that you are God," I am not. I'm just a tool in the hands of the Almighty, and I do my best. And if it succeeds, it helps. I'm happy about it, and it's not something that I can guarantee that things can happen, but that's the way life is.
Thank you, sir. Thank you so much for giving 1 hour of yours, exploring your life, exploring your success. So many who will listen to this would love to follow their passion. Your passion was in organization, teaching, and doing excellent surgeries towards the woman health. I truly feel today, Pune OBGY Society want to salute you where you have reached, and we feel proud Foxians that our Foxy leader is today the world leader. Thank you so much for your time, and thank you for this interview, sir. And
Thank you very much,
all
Sunita.
happiness and health.
It's been a pleasure talking to you, and coming from the city of education, Pune.
Yes, sir. Thank you so much. Thank you for
Thank you.
your time. And I'll send you the video clip to you. Thank you.
Thank you.